good evening. I'm Wesley Gibbings on TTT. You can also follow us live on Talk City 91.1 FM and on TTT Live online on Facebook as we continue to keep you updated and informed on the COVID-19 virus and its impact on Trinidad and Tobago and how we are responding. There have been reports of long lines at the offices of the National Insurance Board as many who have been retrenched or terminated try to obtain the salary relief grant. Well, this morning at a news conference, Minister of Social Development and Family Services, Camille Robinson-Regis, expanded on the plans in place for such affected persons.
Thank you very much for this opportunity to again indicate what the measures are, and really to take this opportunity to indicate that we empathize with those persons who have lost their jobs or who are now in a very confused state because they are not sure exactly what to do or where to go. And I realize that that is why people have been crowding the offices of the social welfare and also the NIB and several other offices. We understand what you're feeling, but we will not get through this together if you crowd the offices. We do empathize, we do feel sorry about what may be happening to you now, and certainly the uncertainty that you're experiencing. But we're trying to make sure we do everything to assure that each person who needs assistance receives the assistance. So please do not crowd the offices because, as my colleague, the Minister of Health has been saying, and Dr. Parasram and my colleague, the Minister of National Security has said, crowding can create some difficulties for us. So do not crowd the offices. What we are doing at social welfare, we are putting customer service representatives at the offices who will deal with you specifically. Let me make the point that the persons that we are dealing with specifically at this time are those persons who may have been retrenched, terminated, or got a reduction in their salary because of the current circumstances. And I mean circumstances that may have begun from March 1st. And that will include persons such as were spelled out at the businesses that we talked about in the public health order. And let me just repeat. We are talking about persons who may have worked at a bar, either licensed or unlicensed, and are not now working because that bar is closed. Persons who were working in a club, and that club has been closed. You are the person we're talking to. Person who worked at a theater, persons who worked at a cinema, persons who worked at a gaming house or betting office. Those are the persons that we're talking to, persons who may have been working in a restaurant that is now closed, and so you are no longer employed, or you may be getting a reduced salary. Let me say two things to those people. One, the NIB will be dealing with those that belonged to a registered business and you were getting NIS. But the NIB is not yet ready because the Minister of Finance did say that the guidelines will be out in 7 days. So please do not go to those offices. They are not quite ready. Secondly, with regard to those of you who I just listed, who may have been employed and were not getting NIS, or you may be self-employed and were not paying NIS, but you find yourself in this position where now your business is no longer operating, the Ministry of Social Development will deal with your issues. As I said, in every area where we have an office, we are putting customer service representatives there, but please try not to crowd the offices. We will deal with each and every one of you. In addition to that, with regard to those persons whom I just spoke about, the Ministry of Labor has opened an online portal where you can submit your information, so you do not have to come to the offices for that. If you do feel you need to speak with someone, we have the customer service persons who will be there in place from tomorrow at each office. They will be having a special desk. So you're just going to go to those people, but you're not going to crowd the offices. Let me repeat. We understand that you're anxious. We are also sharing in your angst. And that is why we have put these packages of this social package in place to ensure that we can deal with you. We have 10 offices throughout Trinidad, and we have offices in Tobago. So we will be dealing with you. We know what we're doing. We understand what you're going through, but it is not helping you or us if you crowd the offices. So I hope I've made that clear. Let me repeat what I said before with regard to the food card for children who are on the school feeding program. There are children registered on the school feeding program that is conducted throughout the education system. Only the parents of children who are registered to receive school feeding will be given a food card once you are not already in receipt of a food card. Let me repeat that. Once you are not already in receipt of a food card, you are entitled to get a food card if your son or daughter was registered with the school to receive school feeding. These food cards will be given out by the MPs. However, it is from a list that is already prepared, a list that we got from the Ministry of Education. That list in the main has telephone numbers. The MPs will have possession of the list, and the persons who live in their constituency will be called by their offices because the list in the main has telephone numbers of parents. And you will come to the MP's office when you are called. So I hope everybody understands that. With regard to persons who now are in possession of a food card, those persons will receive in their April food card a top-up of their food card. And that top-up ranges from $150 to $450. And it will depend on the value of your card. In April, you will get all 3 months at the same time in the top-up. With regard to persons who have been recently retrenched or terminated or have their income has been reduced, they are also entitled to receive the food support, and you will receive a card of $510, and you will also get $510 each month for 3 months. We are asking that the persons who are on public assistance and disability assistance, we are indicating again that you will also receive an extra support in your normal way. So if you normally receive your public assistance or your disability assistance grant through a direct deposit, that is a deposit to the bank, you will see the difference in your bank because you have a card and you will see that there's more than you normally get. Those of you who receive it by check, the check will come in the normal way, And you will see in the middle of March, you will get, in the middle of April, you will get an extra check, which will be the 3-month top-up. Let me move now to income support for current beneficiaries of the Public Assistance Grant and the Disability Grant. Those persons who are receiving that kind of support, you will see the changes in the amount you get for a 3-month period all together. We also have a grant for persons who pay rent. Rental assistance, if you have been now on a reduced income, you have been retrenched, or you have been, terminated, we have rental assistance of up to $2,500 per month in accordance with the established policy of the ministry for an initial period of 3 months. If this continues, we will give you that same amount, $2,500, for another 3 months. However, if it continues beyond that, that assistance will be given for another 3 months in the order of $1,500, and if it continues beyond that, you will get assistance in the order of $1,000 for a further 3 months. With regard to the socially displaced, we have said that working with the Ministry of Health, the Trinidad and Tobago Police Service, and the Ministry of Social Development and Family Services, that we are instituting the Move Along policy, and that is a policy where we move the socially displaced to the already established NGOs that deal with these people. In these circumstances, we're trying our best to ensure that we do get our socially displaced off the streets and into these homes. The issue is that there is a subsisting judgment that says that according to their human rights, we cannot just pick them up off the streets. So I hope the population remembers that and understands that. So we have to use moral suasion. Let me also say that once they go to these places, we will be giving these NGOs additional financial support to ensure that they can provide meals for their additional charges. Ladies and gentlemen, I want to just reiterate that we understand the angst that you're going through. We understand that this is a very uncertain time, not just for you who fall within the clientele of the Ministry of Social Development and Family Services, but for all of us in Trinidad and Tobago. But once we follow the guidelines and do what we're supposed to do not crowd the offices, do not rush to the offices, just go in the normal way. I know you're nervous, I know you may be frightened, and we understand the situation. But in order for all of us to get through this together, we have to work together. We know you're anxious, but please, we have the ability to take care of you, and we will do that. We're sorry that we all have to go through this, but we are ready to take care of you, but you need to work with us at the Ministry of Social Development and ensure that you do what you're supposed to do. Let me say that all the guidelines for accessing our services, that is the guidelines and the forms, will be available from 4 o'clock this afternoon on the websites of the Ministry of Social Development and Family Services, the Ministry of Labor and Small Enterprise Development, and on the website of TT Connect. We also have our hotline, and those numbers will be made available to you. So thank you very much. And we understand. So we know you're nervous, we know you're frightened, but we have things in hand and we'll take care of you. Thank you.
Development and Family Services, Camille Robinson-Regis, outlining the various steps being taken to assist those most affected by the fallout from the COVID-19 pandemic. We take a short break, and when we come back, we take a look at how religious organizations are being impacted and what's in place for people to continue to worship at this time.
Speak up.
Speak up.
Speak up.
Citizens sharing their good news. During the past 4 years, over 35 community centers were built or refurbished. Residents of Mount Hope, Mount Lambert, La Pastora, Santa Cruz, Chiclan and Bonia Aruca are among those excited at receiving their brand new facility.
My name is Angela Ojo St. Rose.
My name is Kendon Hall.
Selena Richards.
Today is a red letter day and I am very thankful for all who, especially the minister and the community development team.
This is a blessing to the community.
I think it's a great opportunity for the youths. We'll be able to hold our football club, our cricket club, and a lot of courses.
Maybe use it for great things and not just like stand up here and get most.
So I want to say thank you, thank you, thank you.
New community centers improving the lives of residents. This was a production of the Ministry of Communications, Information Division.
Knowledge is power. For students at home following the closure of school to contain the spread of the novel coronavirus, now you can view TTT and stream live on Facebook at TTT Live Online SEA Time, focusing on mathematics and language. All you have to do is tune in Monday to Fridays for mathematics at 9:15 a.m. and language at 1:15 p.m. SEA Time, Mondays to Fridays on TTT and streaming live on Facebook at TTT Live Online is an initiative of the Ministry of Education in conjunction with TTT Limited. The following message is brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy. Clean all high-touch surfaces and protect yourself against COVID-19 virus. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, keyboards, toilets, faucets, and sinks. Diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common household disinfectants can be used. Do not dry surfaces after wiping them down. Surfaces you are disinfecting need to stay wet for the amount of time listed on the label of the product used. The contact time with disinfectant is what actually kills germs. Do not reuse disinfectant wipes on multiple surfaces. These can transfer germs from the used wipe to other surfaces. Use one wipe for each surface and then throw it out. It's up to you to protect yourself and your loved ones from the COVID-19 virus. The preceding message was brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy.
Welcome back to Response to COVID-19. I'm Wesley Gibbings on TTT, Talk City 91.1 FM, and TTT Live Online on Facebook. Now we're going to take a look at how different faith-based organizations are dealing with the virus, with the pandemic, and not being able to carry out their usual religious practices. First on the phone is Pastor Francis Warner of the St. Augustine Evangelical Bible Church. Francis, good evening. Do we have Pastor Warner on the line?
Yeah. Yes, Wesley, how are you?
I am fine, man. So how have things been with the declaration that things are not going to be normal with respect to religious observances and practices?
Well, first of all, the decision by the government to ask all religious organizations not to hold meetings, etc., is a sensible move in light of how contagious this virus is. And, of course, it necessitates a reaction, a response from us to the situation, because if we cannot meet physically, but we still need to as God's people to meet together. So what we have done a lot is had a lot of online connection. So, for example, our Sunday morning service last Sunday, we used YouTube, so persons were able to tune in to YouTube and get the service, and it was well received. We've also had prayer meetings. Of course, again, at this time, the church needs to be seeking the face of God. So our prayer meetings have continued. In fact, our church prayer meeting is going on right now using Zoom. So they continue to pray, and then things like our Sunday school classes. Each Sunday school class was connected to Zoom, and Sunday school runs from the married couples class to the young adults through to the teenagers, and then even to the smallest ones. Classes met in their group online.
And I presume that you're aware that some churches did not find it very easy to switch to the mode of operation that St. Augustine has moved in. Were you able to make contact with any of them? And what was the general feedback from your congregation to those who were essentially ignoring the best advice on this?
Well, I feel, you know the saying, no news is good news. I want to switch it around and say sometimes good news is no news, because the government has zeroed in on churches that have ignored the instructions, and of course rightly so, because they do raise a threat to our well-being as a nation. However, some persons have piggybacked on those offenders and made sweeping condemnations of the Christian churches and have bad-talked Christians. It's like a class where two of the 35 students don't do their homework, and then the teacher angrily berates the whole class and calls the whole class lazy and irresponsible, etc. No. What you need to do is just highlight the offenders and deal with them. Most churches have complied. Those churches that have not complied, of course, need to be dealt with, but don't piggyback on that and make sweeping statements with regard to the church on the whole, because the church in general understands the importance of these rules and directives, and we understand that this has nothing to do with trying to stifle the rights of the church to proclaim Christianity and the right of the church to stand for what it believes. These things are two exclusive things.
And how are you handling some of the rituals, communion, baptisms, and that kind of activity?
Well, we will not be able to have things like communion and baptism and those types of things, because of necessity, you'll have to gather as a group for that, and we don't intend to do that, because that will go outside of the directives of the government. So those things will have to be put on hold. However, we will continue to meet to the best of our ability online.
And what have been the key messages you have been sending to the congregation?
Well, first of all, it's in urging everyone to observe all the hygiene tips and all the health directives that have been given. Things like washing your hands and all those, we have asked persons to comply with it. We have also encouraged persons not to panic. So first of all, put your faith and trust in God. First of all, because we understand that ultimately our lives, our salvation, our safety and protection lies in our relationship with our Lord and Savior Jesus Christ. So we encourage people to continue to foster that. And then we encourage people to be calm, to experience the peace that passes understanding in the midst of unease. And then we try to encourage others to see that peace. And then we, as a church, encourage persons who are facing difficult situations, because it's a fact we expect as it continues that persons are going to be put on the breadline, that persons are going to be facing personal hardship as a consequence of businesses shutting down, etc. So we are on alert, to stand by and come alongside those persons and be with them. but ultimately we want to encourage others all of the members of the church to keep trusting God, to be calm, not to panic, but also not to be casual and treat it as a casual thing. And of course, we're trying to help others, and those who are in need, to seek as a church to give them assistance.
Okay, I want to thank you very much, Pastor Francis Warner of the St. Augustine Evangelical Bible Church. We'll take a break now, and we'll be right back.
The winning numbers in the National Lottery online draws for Wednesday, 25th March 2020 at 10:30 a.m. Playway, the number 28 Redfish, Mega and Mega Ultra Ball called. Pick 2, the numbers 15 and 19 in that order, Mega Ball called. Pick 4, the numbers 8, 4, 8 and 1 in that order. At 1 p.m., Playway, the number 18 Waterboat, Mega Ball called. Pick 2, the numbers 17 and 2 in that order. Pick 4, the numbers 8, 8, 1 and 6 in that order. At 4 p.m., Playway, the number 16 Jamet. Pick 2, the numbers 10 and 13 in that order. Pick 4, the numbers 2, 3, 0 and 5 in that order. And at 7 p.m., Playway, the number 8 Tiger, Mega Ball called. Pick 2, the numbers 2 and 14 in that order. Pick 4, the numbers 7, 9, 0 and 1 in that order. Cashpot, the numbers 10, 2, 12, 6 and 11 in any order, and the multiplier is 2.
The following message is brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy. Practice social distancing and protect yourself against COVID-19 virus. Keep your distance from other people. Respiration droplets from a cough or sneeze can travel up to 6 feet and be inhaled into the lungs of the person within range. Protect yourself by staying out of reach. Make a conscious effort to avoid crowds. For example, if within range, think about walking or riding a bike to a destination instead of taking public transport. Keep your distance and avoid contaminated surfaces, because more people means the more surfaces get touched. For example, door handles, phones, remote controls, light switches, and bathroom fixtures. Don't hug or shake hands. If you have to meet with someone in person, find an alternative greeting, tip your hat, wave, or offer a friendly gesture. It's up to you to protect yourself and your loved ones from the COVID-19 virus. The preceding message was brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy.
This is The Difference, a television, radio, and social media series in which we remove the clutter. I'm Samantha Best. Citizens living and visiting the capital will soon have access to further improved health services in a state-of-the-art facility at Port of Spain General Hospital. The sod-turning ceremony for the new central block of the Port of Spain General Hospital took place in December, and construction work is underway on the structure. The new billion-dollar facility will replace the 58-year-old central block, which was closed in August 2018 after a 6.1 magnitude earthquake. The new block will include a 540-bed tower, a coronary unit, a 6-bed plastic surgery unit, an operating theater and recovery room, intensive care unit, high dependency unit, and also provide medical, psychiatric, pediatrics, and ancillary services. The construction of this new 13-story central block is in line with the government's plan to provide overall quality healthcare infrastructure across the country. The project is being completed via a public-private partnership agreement, which was signed in May 2019 between the government and the Shanghai Construction Group Caribbean Limited. The nation's quality healthcare facilities are being further improved for all citizens with a new state-of-the-art facility in Port of Spain. And new hospitals are being constructed in Arima, Point Fortin, Sangre Grande, and there's an arrangement with the University of the West Indies to open the Cuba Hospital. This is the difference.
Welcome back to Response to COVID-19. And this evening we are looking at the impact of the COVID-19 pandemic on religious organizations of Trinidad and Tobago. Joining us now is Pundit Hardeo Persad, the Paramacharya of SWAHA. Pundit Persad, welcome to the program.
Thank you.
Pundit, what are the essential messages you have been relaying to followers of SWAHA during this time? What are the main messages you have been transmitting to them in terms of coping with the situation, how they can continue with their religious practices in the face of the restrictions that have been put in place?
Yes, well, the very first thing is that we need to follow whatever instructions given. You know, sometimes we tend to believe that we can go on our own, but if they say like social distancing, you know, whatever, these practices should be maintained. Now, this does not affect in any way how Hindus should pray. For there are different ways we pray. There is a collective prayer and there are individual, you know, we can pray as individuals. So, social distancing, I think, is very important to prevent the spread of the disease. And people can continue their normal prayers on a daily basis that they are accustomed doing. You know, Hinduism teaches time, place, and circumstances. You make adaptations to suit. So we can survive anywhere. So that there's not a case of not praying.
Now,
But there's a case of praying on your own. Yes.
One of the things that crises tend to accentuate is the social role of faith-based organizations, the manner in which it can guide followers of the various faiths in a positive direction in the midst of a crisis. So what specifically is being done with respect to the followers of SWAHA and the messaging and the actual practices?
Well, the thing is that, you know, we advise as much as possible people should stay home. All right? We have been preaching all these years. We all understand that different circumstances arise. And, you know, coping skills have been, you know, discussed with people over the years. It's that, you know, time and again, we have to implement what we have been taught. And this is one such time. So we ask everybody to just follow the instructions, stick to your prayer. At home, that is, stay together in this way, praying to the divine, and be positive in your approach to life. Every cloud has a silver lining. Whatever happens in life, there is always a positive to come out of it. So therefore, we need to be positive in our approach to life. Everything has an energy, and therefore the energy must be positive in what we are doing here. If we are positive, we'll all see this through. Everything has an end, as it has a beginning. So we need to be strong, and coping skills are important.
Now, some practices such as shavings and cremations and so on will no doubt be impacted with respect to the size of crowd. Yes.
Now,
how are those things?
Funerals we have to do because, you know, we are guided by certain rules and regulations. And the other ceremonies like shaving and so on, it is my firm belief that we can make adaptations to such practices based upon the circumstances. You know, so sometimes tradition is very difficult to stray from. People are caught up with tradition. And there is a fear in their mind to not to change things otherwise. But it is my firm position, and this is SWAHA's position, that if we understand why we do what we do, then it's quite easy to make adjustments based upon time, place, and circumstances, which is what we have been doing. SWAHA.
Now, I'm sure, Pundit Persad, that you're being approached by scores of people who are coming to you with different kinds of personal and communal issues that they feel very uncomfortable about. What are some of the issues that they come? What are some of the questions they're asking you, and what kind of guidance are you providing to them?
Well, at this point in time, there isn't too much interaction, right? Because, like for instance, now is an auspicious period of time. I have cancelled all my appointments. I have, you know, put aside everything, and I've been advising people likewise. If there is a problem, you can call, right? But so far, I have not been receiving any kind of serious calls or whatever it may be that will demand some special interaction. So far, as far as I'm concerned, things are going kind of very peacefully, very quietly, and people are following what they have been told to do.
Okay. Well, Pundit Hardeo Persad, Paramacharya of SWAHA, I want to thank you very, very much for spending this time with us this evening. All the very best.
Most welcome. Thank you.
Thank you, sir. Okay, we're going to take a break now, and we'll be right back with more discussions on this.
There are lessons on TV, there are lessons online, and then there is a complete educational system that can transform your home into a safe, interactive virtual classroom with video-based lessons to keep your child's attention, wall charts for quick reference, flashcards to improve their visual memory, reading books to let their imagination grow, board games for learning while having fun, parental guides so you can help them learn, erasable writing mats for continuous practice, and workbooks to help them focus and stay on task. No internet connection required, nor does your child have to be online to use these educational systems. Call us now and receive a free Kindle Fire with your purchase, or if your child has a tablet, contact us for a software and workbooks version. This offer is for a limited time only.
The COVID-19 virus, previously called novel coronavirus, is part of the family of viruses that includes the common cold and other respiratory syndromes. Protect yourself and loved ones from COVID-19 by washing your hands with soap and water or using an alcohol-based hand sanitizer. Avoid close contact with persons who are sick, and by covering your nose and mouth with disposable tissue. When you cough or sneeze, discard the tissue immediately or sneeze into the crook of your elbow if you do not have a tissue. Ensure to thoroughly cook meat and eggs before consumption. If you develop fever, cough, or difficulty breathing after coming from a country with the COVID-19 virus, please seek medical attention at the nearest health institution. Remember, prevention is the most important action you can take to protect yourself and your family from getting COVID-19. A message from the Ministry of Health.
Welcome back to Response to COVID-19. And this evening, we are spending some time looking at the impact of the various measures taken by the government to address the problem of the COVID-19 pandemic. Joining us now to share with us how the Muslim community is dealing with this crisis is Haji Wahid Majeed, President of the San Fernando Jama Masjid. Welcome, Haji Majeed.
Thank you very much. Good evening to you, sir.
What kind of impact has this pandemic and the measures taken by the government to address the difficulties it has presented, what kind of impact is it having on the masjid?
Well, I think it has had a very large impact, especially as the masjid is normally a place where people congregate. And being a Jama Masjid, you would normally have people coming, especially on a Friday, for the Juma Salah. But ordinarily, they'll be there for maybe the 5 daily prayer. It's just that with 5 daily prayer, the amount of people on there might not be the same as on a Friday. But it has impacted tremendously. And I think we were following the directives of the government and understanding the need for social distancing. We had no choice but to suspend those services for the Juma Salah for the general public.
So what are people doing for the Friday evening prayer?
The Friday prayer, I mean, it's a lunchtime prayer, right? It's normally held that time. Some people have been gathering in their homes, those who have had this social distancing and kept themselves at home. They've been gathering in their homes and praying at that point in time. Others have ventured out to certain masjids that would have allowed them to gather in small quantities at different spaces to do so. So it has been a challenge, but I think the idea that people can also pray by themselves in their own space allows them to be able to communicate with God at any point in time.
What have you been telling the followers with respect to how they can best cope with this period of crisis and difficulty?
Well, I've been following your discussion this evening, and similar to the pastor, our presence on social media allows us in a way to get out to the people what we are doing in the masjid. And we have been using the social platform, especially our Facebook page, to get out those activities that we would normally carry on with others. So they were able to follow us live for certain practices that we would have had on a Thursday evening, or even for our Jummah. On Friday, we had like 9 people there, and we were still able to do that
so that they could be part of the congregation, as it were.
Now, at times like these, people turn to their religious leaders for guidance on a number of matters. There's a lot of fear. There is some panic, and there's very deep concern about their well-being and the well-being of their families and communities. What are some of the issues they are bringing to you?
Well, not only to myself, but through the Imam, Maulana Atif Majeed, we find through our WhatsApp group, we have people asking questions as to what we should do in these times. And he has been providing, just as the masjid has, providing the sort of guidance that we obtain from the World Health Organization or from the local authorities and even from the local Muslim bodies that have come across or made some statements with respect to this. So we are able to provide them with some sort of guidance going forward as to how they should deal with this.
Now, the Prime Minister has called for a day of prayer on Sunday, and there's going to be some kind of formal proceeding at the Prime Minister's residence. But is your organization planning sort of parallel activity? Is there anything special that's going to be happening on Sunday in keeping with the call for a day of prayer?
Well, I know the call was made. I'm not too sure whether our Imam was invited for that, but we ourselves would not be having something specific to that time unless we are so directed by our Imam. But similar, like yesterday, or not yesterday, this morning, there was a call worldwide for a moment of prayer at 7 o'clock this morning. We joined the rest of the world in doing a similar exercise. And I'm sure if something like that is to be part of our system for Sunday, we'll also be part of that. Okay.
Well, Haji Wahid Majeed, President of the San Fernando Jama Masjid, I want to thank you very much for staying with us on COVID-19, our follow-up on our discussions on the impact of the interventions taken by the government of Trinidad and Tobago to address the issues, the difficulties, the challenges posed by the COVID-19 epidemic, pandemic.
Thank you very much.
Thank you very much. We want to wish you all the best.
Same to you, sir.
Good. Now, we've come to the end of our program tonight, and there are many issues that are emerging, especially via social media. And I think that as media professionals, the best advice we can give is to rely only on authoritative sources. Here at TTT and Talk City 91.1 and the network, there is a commitment to present only verified information. And I don't think that you're going to get more than that. I think that there has been a strong attempt to bring verified information and guidance, as you would have witnessed from the presentation from the Minister of Social Development earlier this evening. So stay tuned to TTT News and stay tuned to TTT Live Online, Talk City 91.1 FM for reliable, confirmed, verified news and information. For this evening, I would like to thank our guests, Pastor Francis Warner, Pundit Hardeo Persad, and Haji Wahid Majeed for their contributions. And remember, the COVID hotlines are in Trinidad 877-WELL, 877-WELL, or 877-9355, and in Tobago 800-HEAL, 800-HEAL, or 800-4325. I'm Wesley Gibbings, wishing you a good night. Please stay safe.